So does sugar feed cancer? Well, that's one of the most common questions that I hear from my patients, and I would like to give you a thoughtful answer. So I'm Dr. Julia Saylors, integrative oncologist, and today in Mini Med School, we're talking about the relationship between sugar and cancer. And the short answer is that it's not as simple as sugar feeds cancer, so eliminate all sugar, because glucose is essential for the majority of cells in your body, including the healthy ones. And having healthy cells functioning well is critically important, especially for patients that are going through cancer treatment. So I want to be clear that I do not believe that whole fruits and vegetables feed cancer. The fiber, the antioxidants, the phytonutrients that they provide are protective, not harmful. But here is what the science does tell us. So your cancer cells are known to consume glucose at a much higher rate than normal cells, and this is called the Warburg effect. More importantly, chronically elevated blood sugar drives insulin resistance and raises levels of a growth factor called IGF-1, insulin-like growth factor. And this is where the real cancer connection lies. So every day, your body is making cells that have small errors and damages in their DNA, and we have a way to repair these, or the immune system identifies these cells and destroys them before they can become a problem. But when IGF-1 and insulin are chronically elevated, they send constant signals telling cells to grow and survive rather than to stop and self-destruct. And it creates an environment where damaged cells can accumulate mutations over time and potentially develop into cancer. And the data continues to grow. We've seen with the drug metformin, for example, which lowers blood sugar, that better metabolic control appears to positively impact cancer outcomes. And we're now seeing similar signals with the GLP-1 medications. So I believe the goal is not elimination, it's control. Stable blood sugar, lower insulin levels, and a diet rich in whole foods is one of the most evidence-based things you can do for both cancer prevention and supporting your health during treatment. And I have a guide on inflammation, so if you comment inflammation below, I'm happy to send it to you.